Good afternoon. I have that the time is 6:00 p.m. Are we ready to start?
We are ready when you are, Dr. Kearney.
Good afternoon to everyone and welcome to the Cumberland County Board of Health meeting. My name is Dr. Cynthia MacArthur Kearney, registered nurse, vice chair, and I am filling in for Dr. Ojo, who is on vacation this week. And welcome all guests, Dr. Green and the staff of the Board of Health, and all guests as we call the meeting to order. I'd like introductions as well of the Board of members present to ensure that we have a quorum.
Jennifer Braidboy, clear.
Dr. Jennifer Braidboy, okay. Mr. John Larch is present.
Here.
Okay. Dr. Assad.
Present.
Dr. Kent Dean. Kara Wade.
Here.
Dr. Jeanette Council.
Dr. Council is expected to be in attendance, but it just has not yet arrived.
Okay. And Mr. Joseph Pfizer.
Here.
And Dr. Sam Fleshman. Okay, we will proceed. We'll have a moment of silence. Okay, the first item is the agenda. I hope that everyone received their copy of the agenda and reviewed the agenda so that we can approve. Do we have a motion to approve the agenda?
I make a motion to approve.
Second.
Okay. Agenda approved.
Dr. Kearney, can you ask for a vote so we can make sure that we have affirmative votes?
Can we have a vote? A vote to approve the agenda. All those in favor say aye.
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 Agenda approved. Now approval of the meeting minutes from March 15th, 2020. We have a vote to approve the meeting minutes. Do we have someone to approve?
I make a motion to approve.
Do we have a second motion to approve?
Second.
Okay. All those in favor of approving the meeting minutes, please say aye.
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 Okay. Approval of bad debt write-off, page 6. Miss Candy York.
Yes, ma'am. Good evening. On page 6, you have a request in your packet to write off bad debt the month of March 31st, 2022. As of December 31st, 2021, the debt represented in this spreadsheet was over 90 days old. From January through March, we attempted to collect by sending out letters to the actual patients. The ones that did not respond, the accounts are represented in here. We are requesting to write off $18,660.58. Since we began this program in 2012, we've written off $953,000 worth of debt, and we've collected $286,000 of that debt from the North Carolina Debt Set-Off Program, which is around 30% collection rate. And I'll be happy to answer any questions.
Are there any questions for Ms. Candy York? If not, may I have a motion to approve the bad debt write-off?
Make that motion.
Second motion?
Second.
All in favor say aye.
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 Motion approved. Dr. Green, we do have enough for the quorum.
Yes, ma'am.
Thank you.
So the
In reference to the tobacco policy, will you be reviewing that, Dr. Green, in the report, or will you review that now?
I will review that now. I'm going to pull up some slides here. Thank you. So some of this information is a little bit of a repeat from last time, but I just wanted to make sure that everybody was aware. So as a part of our accreditation efforts, we are required to have a tobacco-free facility. For our new board members, you're going to hear us talk about activities when we talk about accreditation. So just for your reference, this is activity 30.9, and it requires 100% tobacco-free facility policy that prohibits the use of any tobacco product anywhere on our property at all times. It also prohibits the purchase, the acceptance of donations, and the distribution of tobacco products on our campus and by our staff and to our clients that they serve, or the clients that we serve. And it also requires that we promote tobacco cessation. So we do all of these things already. We previously had this as an administrative policy for the health department that I signed each year. The new our accreditation requires that the Board of Health sign this policy and approve this policy. It also requires that we update our signage for the to the international smoking sign symbol, which includes e-cigarette and smokeless tobacco products. So we've done that. We've updated the policy to reflect just a few changes based on our general statute. So you'll see that in the policy that's in your packet. The second part of our accreditation requires, and I'm going to differentiate here, not just tobacco-free facilities, meaning our buildings, but it also requires our grounds to be tobacco-free, or us to make an effort to make our grounds tobacco-free. So a few years ago, the new North Carolina general statute gave clear authority to local health departments to prohibit tobacco products in and around the health department. So many health departments in the state have facilities and grounds that are tobacco-free within, let's say, 50 feet. We have expanded that as recommended by the tobacco branch, but also best practice in the state and in the country to have our grounds tobacco-free. So you as the Board of Health have the authority with approval of the county commissioners to approve regulations that can make all government buildings, not just the health department, grounds and public indoor spaces tobacco-free. That would take some action by the county commissioners as well. So and that's not yet where we're asking tonight. What we're asking tonight is to make that consideration for the health department and our grounds, specifically at the health department. So we need to implement and utilize the definition from the North Carolina General Statute, which says, which defines the tobacco products based on new data and evidence. And that means that tobacco, any product that contains tobacco that's intended for human consumption, that includes tobacco-derived products, including vapor products or the components of a vapor product. So what you're seeing, and what you're going to see in the policy is this implementation of this new updated definition. And so what our accreditation requires, again, is that we make an effort to achieve the prohibition of tobacco products within 50 feet of all health department facilities. And we already do this again. So this is already our health department buildings. And our grounds, if you come to the health department on Ramsey Street, our grounds are already tobacco-free on our campus. So now we're just asking that the board sign this policy. So the policy will apply to our Ramsey Street location, Wick and Hope Mills and Spring Lake, and then the environmental section of environmental health. That is a shared space. And so we're applying the policy specifically to the part that is environmental health only. And then we will, of course, update the signage and include, with the advent of more mobile units, the policy also addresses our new mobile unit, so that will also be tobacco-free, and we've gotten signage updates out as well. So tonight we're asking for a vote and a motion and a second and a vote from the board to approve the policy that was in your packet that reflects what's on the slides here. And then also just would like some feedback from the board about ongoing collaboration and presentations to our other regional partners. You all have, some of our board members that have been with us a while have met Travis Greer. He was our previous tobacco control manager for the region. And so he's done a lot of work over the last several years to work with counties in our region and local partners on their tobacco efforts. And so we'd just like some feedback from the board about continuing those efforts and making sure that we can support other agencies in their tobacco-free policies as well. So Dr. Kearney, if there are no other questions, I'll turn it back over to you for consideration of a motion.
Thank you, Dr. Green. Does anyone have any questions or comments for Dr. Green? If no comments, can we make a motion? Can I have someone to make a motion for approval?
I motion for approval.
Second.
I'll second.
All those in favor, would you say aye?
Aye.
Motion approved. Thank you, Dr. Green. We will now go to is there any public comment for today?
There's nobody signed up for public comment.
Okay. Then next on the agenda is the financial report by Ms. Candy York.
Beginning on page 13 of the packet, you have your statement of revenues and expenditures for the month ending March 31st, 2022. At the close of the month, we had collected $14,263,844 in revenue, and our expenses were $13,653,874. Our revenues exceeded our expenditures by $609,969. The excess revenue is due to excess dollars received above budget for our care management programs, which are Medicaid per member per month revenue. In addition, we also have been billing the administration fee to Medicaid for COVID vaccines and also to HRSA for our uninsured patients. On page 14, the expenditures by program. Toward the bottom of the page, you'll see that represents that we have actually expended 57.63% of our budgeted expenses for the year. And that is not including any of the COVID expenditures. If I include the COVID budget and the expenditures for the month, we've actually only expended 48.04% of our budget. The COVID dollars that we do not spend at the close of FY22 actually will roll over to be used in fiscal year 2023. So we will not actually lose those funds, but that's the reason why I broke it down to show you where we're at as far as spending our actual budget without those dollars, since they are multi-year funds. On page 15 begins the revenue report. The first section is our state collections, state and federal dollars. And of course, these revenues are always a month behind. We actually draw down the funds the following month of incurring expenses for all the state and federal dollars. The bottom of the page are our grant revenues. On page 16 is our Medicaid collections. We have collected 77.98% of our actual budgeted Medicaid dollars, which of course, at this point, at the close of March, we should be around 75% collections. We are running ahead in a lot of areas you'll see, and I'll just point out the very first line, the escrow, North Carolina TB EPI. The excess in collections over the budget is actually due to what I spoke to before as far as billing the administration fee for the COVID vaccines that we've administered this fiscal year. Below that, with the North Carolina STD dollars, where we've collected $275,000, that is a big portion of that is due to the fact that the state allowed for us to be able to bill Medicaid dollars for family planning waiver recipients when they receive STD services without having to have the exam. Prior to this fiscal year, they had to have an actual annual exam before those services could be billed. So that's, of course, increasing our revenue there. And then, of course, the case management fees at the bottom of the page, where we've collected $1,765,000, putting us at 91.25% of collections for the year so far. That is the pregnancy care management and the care coordination for children programs, also known here as column CMARC and CHARP as well. That is due to the increase in the number of enrollees in those programs, and we actually receive a set amount of dollars per member per month. And then followed by that section is our fee revenue. We are down a little bit from budget as far as we normally would be at 75%, but we're only at 54.84%. We have seen a turn in our patients that are coming in that actually have insurance or self-pay. But you will notice that in our plot plans, which is an environmental health program, a lot of people are building. So the revenue there, of course, has exceeded already the budgeted amount that we had for that program. And then at the bottom of that section, fees are called communicable disease fees. We've collected $34,162.37. That is the COVID vaccine administration fee that I was speaking of, that we've actually been able to bill to HRSA for uninsured patients. So overall, we have collected 58.32% of our budgeted revenue. Going on to page 17. You have your accounts receivable report that's broken down by program and by payer source. Of course, you'll see our Medicaid percentages are still a little bit up. We're still continuing to have some issues with the health plans and Medicaid health plans with denials, but we are working through with our state consultant as well as the actual Medicaid payers as well individually to address the individual denial issues that we're having across those programs. And then finally on page 18 is our private pay, self-pay, aging report broken down by program and also by the aging. Are there any questions about any of the reports? I'd be happy to answer those.
No questions or comments from Ms. York? If not, thank you, Ms. York, for the report.
Thank you, ma'am.
We will now hear from Ms. Sheena Butler, Food Policy Council update.
Good, thank you, and good evening, everyone. So just wanted to give a quick update on the Food Policy Council. Last summer, we signed a charter with the county commissioners in support of the Food Policy Council, which was established in November of 2021. The council is full and it consists of 15 members representing community residents, 2 co-chairs, 1 for Cumberland and 1 for Fort Bragg. We also have public health professionals, higher education, which includes our colleges, community college and universities, local farmers, local government, and Cumberland County and Fort Bragg school systems. Currently, each member has been appointed by the county commissioners, and we look for that to potentially be reappointed, hopefully next year. The council has been reviewing research pertaining to food insecurity concerns, and that is for both communities. The council is utilizing this research to establish future goals and develop also an action plan. Some of the research comes from food system assessment, which is mentioned in the second bullet of the snapshot. We use the assessment along with the interactive map to identify things like food deserts within Cumberland and Fort Bragg. So we had 50 community residents to assist us with collecting data on the availability of healthy food access. And that was in like grocery or corner stores, as well as produce stands. Overall, this data helped us to identify opportunity sites for healthy food distribution and barriers to food access. So we look for the council to implement at least 2 policies, systems, or environmental priorities that could stem from this research that we looked at or others that we have reviewed. So that's pretty much the update of the Food Policy Council. I did want to take a moment to talk about the resilience. I think it's the next page. Yes. Shifting power and building resilience through community collaboration. This was a National Public Health Week event. It was facilitated by the Healthiest Cities and Counties Challenge Team, as well as APHJ. Nathan Crew, who is a Food Policy Council member, and he is a co-owner of the Crew Family Orchards. And myself, we both conducted an interview. And the interview, we discussed the resilience of the HCCC 2-year grant project. We talked about the milestones we have reached and lessons learned as we overcame some of the challenges with COVID. We also talked about shifting power to community residents and what that looked like in the past 2 years for us. And we hope to continue those efforts. So we want the council to continue working alongside the community members as we generate policies, and that's to help combat food insecurity. Thank you.
Thank you very much, Ms. Butler. Does anyone have any comments or any questions for Ms. Sheena Butler? Okay, we're ready now, Dr. Green, for the director's update.
Yes, ma'am. Share my slides again. William's gonna help me. We will start with our COVID update. So on this slide, a few months ago, the CDC switched from talking about community transmission to talking about our community levels. And that's an indicator of, or based on several indicators. One is our new COVID-19 hospital admissions based on our population size. The second is our the percentage of our staffed inpatient beds that are occupied by COVID patients. And then the last is our case rate based on our population size. So based on those 3 indicators, we are in the low or in the green. That gets updated on Thursdays by the CDC. Since our last board meeting, we've been several weeks in a row in the low. We had 1 week where we dipped in or ticked up into the medium, and then this week and the previous week we went back into the low. So that's good news. We're watching our numbers carefully. We're starting to see a little bit of a rise in cases around the country, so we're monitoring that closely. In terms of our vaccination rates, we have just over 60% of our population fully vaccinated. So that's just 1 or 2 percentage points of where we were last month. And so we've certainly seen a slowdown in our vaccination, the number of people that are getting vaccinated and coming out. Although every time they announce new booster shots, we see a few more people show up to vaccine sites, including for first doses. That percentage is just slightly higher if we pull out the number of kids over the age of 5 that are actually eligible to get vaccinated. This slide shows the percentage of our population that's been fully vaccinated and has at least 1 booster dose. And so we're at about 15% in Cumberland County. So that we're trailing behind the rest of the state in terms of our booster shots. A quick update on vaccines for our kids and booster shots. So since our last meeting, the CDC has identified that older adults are now eligible to get a booster shot. So our families, our children, our adults over the age of 50 are now eligible to get a second booster shot. So for a total of at least 4 shots. If they're at least 4 months after their first booster dose. So that's either for Pfizer or Moderna. They have not changed the definition of up to date. So we for several months now, we've been shifting our language to talk about not just about being fully vaccinated, but about being up to date. So you are considered up to date if you've received at least 1 booster shot. So you do not have to get both booster shots to be considered up to date, although we would encourage people to get it if they choose to. So the CDC has language this time about that you could get a booster shot if you were over the age of 50. Our pediatric vaccines, we are hopefully getting closer. Both Pfizer and Moderna have plans to submit data for FDA review for children under the age of 6 in April, so hopefully by the end of the month. And we're expected to have an amendment to the emergency use authorization by May. And I just wanted to flag this for our board members. You're going to start seeing these ads across the county and on our social media. This is our spring into summer campaign, or the state health department spring into summer campaign, promoting that vaccines be available for children, or for that vaccines, people get vaccinated and boosted as we move from spring into summer. So it is time for me to give you a quarterly update on our strategic plan. So I'm not going to hit every area of our strategic plan because we've done a couple of these already, but I just want to make sure, update you on the new initiatives. So one of the board's first priorities was about increasing staff recruitment and retention and assessing employee satisfaction and morale. So we've been able to, with the lower levels of COVID in our community, been able to resume our attendance at recruitment fairs. And so we had a goal and objective around attending a number of annual recruitment events. And so we've resumed doing that. And so we're excited to be out and about again, trying to get people into the building. Last month or the month prior, we provided an update on our ARP grant from the state around workforce development. That person has been hired, and that individual is going to work on several staff and recruitment initiatives related to diversity, equity, and inclusion, and making sure that we have policies that reflect DEI. And this is a regional program, so not just for Cumberland, but also for the other counties in our region. We are excited because we finally have a go-live date for our new EHR. Our staff training is set to begin on May 6th, with the go-live date of tentative go-live date of May 25th. So one of the things that we wanted to be able to do was have a patient portal, which we will, and be able to better track our metrics around patient wait time, to be able to get information out on our patient portal about chronic diseases. So all of those strategies related to QRB will begin processing now that we're going to get ready to go live. We had another goal around our medical and death record, or our birth and death records. Some of this is dictated by the state. They went live with NC Day for the death registration earlier in the year, and they hope to be fully implemented by May 1st, 2022. However, the state has delayed implementation of the electronic birth registration system by a few months, or until the end of the year. So while we are making progress on the death record piece, our staff has been trained. We are attending webinars on a regular basis about the death records. There's going to be some delay in implementation of this electronic birth system the electronic system for our birth record. But once that is available from the state, we will, of course, participate and be trained. We had a priority about expanding outreach through social media. So we have our social media team internally to the health department that's been established. We're working on getting them trained on good social media practices. We are live on Instagram and Facebook. And then we've implemented a number of social media and digital campaigns, including, you'll hear me talk about this in just a moment, but including campaigns around STD Awareness Week. We have a hepatitis bridge counselor program, and so we'll be doing some social media posts about hepatitis. As we move into the summer season of festivals and barbecues and church picnics, we'll be talking more about summer preparedness, including safe eating when you're out at a church picnic or 4th of July, Memorial Day, where people gather and tend to leave their food out for a while. We'll be doing some messaging around summer preparedness, as well as thinking about mosquitoes, the availability and prevention of mosquito bites. We're also going to be doing some campaigning around youth mental health, in particular, as we think about the impact that COVID has had on our youth and their mental health. And then, of course, we are always promoting, doing some campaigning around our COVID vaccines. And then you just saw the spring into summer ad. So just as a reminder, the board in February voted on these strategic priorities. Some of these were a holdover from our previous strategic plan. But just as a reminder, we are still working on our strategic plan for 2023-2027. So you'll hear us start to bring some of those pieces in to these meetings as we get feedback from you. So those priorities are about increasing collaboration with military partners in the community. That's a holdover from the current plan, recruitment, retention, and staff morale, health education and health literacy, substance abuse and mental health, reducing our STI incidents, technology, expanding our services, transportation, communication, and normalizing our COVID response. So our internal strategic planning team has begun their work. They have been developing and will develop these priorities into internal and external these internal and external priorities into goals, objectives, and action steps. So our team met last week. They are taking some of those internal facing goals first, or priorities first, and they're putting that work into goals, objectives, and action steps. And then over the summer, early summer, we'll do the external priorities. So we're excited about that. And then we will also bring those back to the board for your review and your feedback. We also invite the public to provide input, just like we did last time. The public is invited to do that at any time, and they can give us feedback as well on those priorities or things that they think that they'd like to see from the health department based on the priorities. Just a note, we do have subcommittees on our strategic planning team about health literacy and health equity, and so that really aligns with some of those priorities that you just saw. We have a grant tied to our work on health equity, and we'll be doing some organizational assessments on our internal work and policies and procedures on equity, and then we have ongoing work related to health literacy. So, one more slide maybe. I wanted to provide a quick example about some of the social media things you saw this spring into summer. But we also, last week was STD Awareness Week. And so one of the campaigns that we helped implement or that we promoted using social media was was the CDC's campaign around talk, test, and treat. And so last week we had some gift cards, thanks to the Cumberland Community Foundation, for people that were getting STD and HIV testing. We've done that in previous weeks as well, promoting the ability to get tested, talking to your healthcare provider, talking to your partner, and then also getting treated if you once you're tested. And so we'll continue campaigns like this. We've also done campaigns again about opioids. So we'll continue each of those things as we move forward throughout the summer, and really making sure that we're using our digital platforms for positive messaging. I did want to draw your attention to, I don't have a slide for this, but as we move into the season of these new opioid settlement funds that are coming out, I just wanted to provide a quick update. We'll be doing a number of community meetings about the opioid settlement funds with the county commissioners as well, of course, who will make those final decisions about how the funds will be used. But our goal is to get feedback from the community, from stakeholders. We'll be doing some focus groups about how best to use those funds. And then we'll take that data and give it back to the county commissioners and of course to the Board of Health for how to utilize those funds. So you can expect some updates from us at the next meeting and certainly in the meeting in June as well. So if there's any feedback from the board about how best to go about that, we'd love to hear it. And if there's no other questions, that's all. Those are all the updates I think I have for you. And check, make sure I have any more slides. Yeah. Thank you, Dr. Kearney. Those are all the updates that I have today.
I apologize. I have a question.
Yes.
In light of the fourth booster, does the Board of Health, Department of Health have a position on recommendation? Since it's, and the way I've read it, it's at the individual's choice to take it, because they don't mean it's up to date if you don't have it. Is there a unified voice that we should be sharing based on your protocols?
Yeah, that's a great question. That's probably the question I've gotten the most in the last several days about. No, it's a good question. So the CDC this time used the language that if you're over the age of 50, that you could get a fourth booster shot or a second booster shot for a total of 4 doses. It's sort of a nuanced difference, because previously they used the language you should get a fourth booster or a booster shot. And so there's a difference in language there. And so one of the things that we want people to weigh is, if you're over the age of 50, you certainly can and could get a booster shot. You could talk to your healthcare provider about your personal health history. Maybe you have some underlying health conditions. Maybe you you're immune compromised. Maybe you are in the upper ranges of maybe you're 90 and not 50 in a few days. So it really, I think, depends on your own personal health history. One of the reasons they may have used the language could rather than should is that we're weighing people that maybe have recently had COVID in the Omicron surge and maybe have some level of protection from that, plus their own doses. And so I think people are going to have to weigh with their healthcare provider that could language about the timing of that fourth dose. But we want to make sure that it's available.
This is Sam Fleisch, Dr. Fleischman. I agree with what you said, Dr. Green. I think it's based on what we've heard and what you said. I think it's something you should talk with your healthcare provider about before you just kind of go do it for those in that population. And I think we also have to continue to monitor infection rates and hospitalization rates as next waves come through. That may drive some of that decision making.
Yes, I think you're exactly right. I think that's part of why we're hearing the could language, is because we're weighing current levels of protection versus what's coming in the future. And we want to make sure that people are protected, not just now, but also in the future. So that conversation with a healthcare provider, I think, is going to be important.
Dr. Green, this is Dr. Kearney. The dose for that second booster, is it the same?
Dr. Kearney, we're having a little bit of a hard time hearing you in the room.
The dose, the second booster, is it the same dosage or is it a lesser dose?
So it's different from Moderna and Pfizer. So Pfizer's the same and Moderna is a different dose, but not different than the other. Moderna is not different from the other first booster.
Thank you.
If that makes sense. So the two Moderna boosters are not different. It's all the same. They didn't change the formula for the Moderna booster. It's all the same vaccine, but as you pointed out, the size of the dose is different for the booster shot.
Thank you. Any other questions or comments for Dr. Green? I would like to share, Dr. Green, the work that your team is doing, working on those internal and external priorities is greatly appreciated from our previous board retreat. Those initiatives that we came up with were so extremely important to the health of our community, and we appreciate that your team is working on strategies of how to move forward with that. Greatly appreciate it.
Thank you.
And I know in reference to the electronic health record, this is a long time waiting and exciting news to hear that the training is on board. So it sounds as if that training is virtual.
Our staff will do a little bit of virtual, a little bit of in-person training. It'll primarily be with our project manager from QRMD doing virtual trainings, and then when we go live, we'll have some on-hand in-person time with us on our go live date and then the weeks following as well.
Was there any infrastructure such as laptops or additional computers or updated computer systems that were added for this?
I think we're having a little bit of a hard time hearing you, but I think the question was there any additional purchase of laptops? And our IT folks are in the room, and the short answer to that is yes. We were able to use, put in the budget last year, the purchase, or for the current year, the purchase of a number of laptop equipment, scanners, things that would help to get us up to date and have the appropriate equipment to utilize with our new system.
Very good. Thank you for sharing that. Next on the list of the agenda, the upcoming events in reference to the workshops. And if you're interested in attending any of those workshops, you need to contact Kelly to make her aware of those upcoming workshops if you're interested. And if we have no further comments in reference to tonight's meeting, we can move to reviewing our membership roster and attendance, which is located on page 22. Please take a look at that and make sure that the information is accurate and reflects your attendance. If you do have any comments or any concerns, you can also reach out to Kelly in reference to the membership roster as well. Any board member comments before we close? Dr. Green, any direction or any comments?
No, ma'am. You have a motion on the floor from Commissioner Council to adjourn.
Okay. Motion to adjourn. We have a second.
Second.
All those in favor say aye.
Aye.
Meeting adjourned.